A state of emergency has been declared for Monroe County due to rising COVID-19 hospitalizations. The announcement was made this afternoon by Monroe County Executive Adam Bello, who says hospital capacity is once again a real concern. And with a new variant likely on the way, he says now is the time to act. Christian Garzone out live for us with more on how hospital systems are managing during this COVID spike. But first we turn to Amel Elhel in the newsroom with a breakdown of the county's plan. Amel.
Adam, Monroe County's first state of emergency came back in March of 2020 when the pandemic was first getting started locally. That order expired over the summer when vaccination rates increased and new cases, hospitalizations, and deaths fell to pandemic lows. But now local officials say we are heading in the wrong direction, and we don't have to be. Under the state of emergency, phase 1 of the county's plan includes a face mask requirement in all county-operated facilities, reinstating a work-from-home policy for county employees who are able to do so. The county is also encouraging local governments and all public and private sector employees to do the same. The county is also expanding rapid test operations in our area, including the county purchasing 750,000 rapid tests for distribution.
We do know how to protect ourselves by going back to the basics. Social distancing, masking, limiting our gatherings, and being cautious when traveling. Those things still matter.
The county executive says the state of emergency will stay in place until hospitalizations are stabilized locally. If numbers don't start improving, phase 2 of the plan will start looking at vaccination or a testing requirement for various entities.
We don't have to get there. We do not need to live in a permanent pandemic. I want to ensure the public that understands why we have implemented this new plan and what it is going to take for us to get it to end.
Today's briefing comes as Monroe County continues to see a surge of new COVID cases and hospitalizations. Today, the county reported 511 new cases of the virus in our area, along with an 8.8% positivity rate, which is the highest it has been since the beginning of this year. Additionally, 443 people are currently hospitalized with the virus in the Finger Lakes region, which is also the highest it has been since the beginning of this year. And while there is growing concern for the new Omicron COVID variant, Dr. Mendoza says there are more pressing issues we need to tackle first, such as the rising hospitalization numbers that triggered this state of emergency in the first place.
We do not know if the vaccines will be as effective against Omicron, but we do know it is effective against Delta, which is here right now.
Mendoza says until we know more about the variant, there is no need to panic. From the newsroom, Amel Elhel, News 8.
Amel, thank you. We continue our team coverage now with Christian Garzone, who joins us live. Hospitals pleading with the public to get vaccinated, as most of the people filling the hospital beds right now are not. Christian, what's the latest from your end?
Well, Adam, the tone today from medical leaders was tough. They say if more people choose to not get vaccinated, COVID numbers obviously are only going to continue to go up and hospital bed capacity will continue to dwindle. The projections, they feel, don't look good. Medical leaders today saying there's no way out of this pandemic unless more people get vaccinated. Dr. Michael Apostolakis with URMC says hospital beds are filling up to alarming levels.
20% of the population that is unvaccinated accounts for 60% of all COVID hospitalizations and 80% of those who are critically ill in the ICU.
Things like elective surgeries could face postponements. Some hospitals could see this as soon as Friday.
Think about the hospital bed you or your loved one may need in the event of a heart attack or a stroke.
Dr. Robert Mayo with Rochester Regional Health says canceling surgeries is something he is sure the public does not want to see.
Maintaining full access to medical care is vital for the health of this community. And we need every individual's assistance in achieving that aim.
Both men say the importance for people to make the choice to get vaccinated is critical.
My heart goes out to our patients. What we believe medically may be safe to postpone for a week or two, to someone else, it's going to be heart-wrenching for them.
COVID cases, he says, are projected to increase with no clear end in sight.
But a significant minority of people are refusing vaccination, and our community is paying the price.
And of course, some could argue some of these problems go back to staffing issues as well in the hospital system. Live in Rochester, Christian Garzone, News 8. Adam, right back to you.
Christian, we thank you. For our full coverage of the Monroe County state of emergency, head to rochesterfirst.com.